Good afternoon and welcome to the World Stroke Congress 2018 in Montreal, Canada. My name is Michel Shamy and I'm a neurologist and a stroke researcher based at the University of Ottawa and the Ottawa Hospital in Ottawa, Canada. I have the pleasure today of interviewing Dr. Hoang Phan, who is a clinical researcher based at the University of Tasmania and presents a number of interesting findings at this year's conference related to differences in outcomes of stroke based on patient sex. So Dr. Phan, can you tell us your main findings that you'll be presenting at today's conference?
Thank you, Michelle, for introducing me. I'm very honored to present my research on sex differences in specific cause of excess death rates after stroke in the Australian Stroke Clinical Registry. So, as we all know that women have been reported to have greater on-cause mortality after stroke, but little is known about the sex differences in causes of death after stroke. Also, whether the sex differences in excess death rates after stroke between men and women. Also, it's uncertain whether the sex differences in excess mortality rate attributed to stroke and other causes among the people with stroke compared to the general population. So our aims were to examine whether the differences in causes of death after stroke and identify the factors that contribute to the sex differences. Also, we will calculate the excess mortality rate attributed to stroke and other causes compared to the population norms. And in our studies, we use the data from the Australian Stroke Clinical Registry, or OSCA as this is known. This is a national registry to collect important information on processes of care and outcome after stroke. We included first ever stroke cases who admitted to 35 hospitals participating in the OSCA during 2010 to 2013. And the causes of death were linked to the National Death Registry. And the causes of death, based on the ICD-10, were categorized as different categories, including stroke, ischemic heart disease, other cardiovascular disease, cancer, and other causes. And the core information collected for the whole registry, including social demographic, stroke type, stroke severity, which is indicated by the ability to walk independently at admission, processes of care while in the hospital, and some discharge information, including length of stay or discharge destination. So far, there were 9,411 first ever stroke cases, slightly more men than women. Women were generally 7 years older than men, and they're less likely to walk independently at admission, which is a proxy for stroke severity. So far, we have found that there were no statistically significant difference in processes of care while in the hospital, including stroke unit access, intravenous thrombolysis, care plan at discharge, or being discharged on antihypertensive agents. Yeah. But we found that women had greater on-cause mortality after stroke, and stroke and cardiovascular diseases are the most common causes of death after stroke, with accounts for more than half of the causes of the deaths after stroke. However, the distribution of causes of death differ between sex, with men having more deaths due to stroke and other cardiovascular diseases, while men have more deaths due to ischemic heart disease or cancer. And when we analyze the competing risk model, women were about 65% more likely to die from stroke or cardiovascular diseases, while they are less likely to die from ischemic heart disease or cancer compared to men. Yeah, and the sex differences in causes of death were significantly attenuated after adjusting for age and severity of stroke. And compared with the general population, those who have survived by 30 days after stroke has an 8-fold greater risk of death due to stroke or recurrent events, and the mortality rates due to ischemic heart disease were about 3 times greater than that of the general population. Then the excess deaths due to other cardiovascular diseases were significantly greater in women compared to men. And lastly, cancer was more than twice as often the causes of death after stroke, but there were no sex difference.
So if I understand correctly then, what you're saying is that while women do worse after stroke, they have higher mortality. That's mostly related to them being older and having more severe strokes,
Yep.
rather than to differences in the care they receive at the time of their stroke.
Yeah, exactly. We didn't find any evidence of sex differences in processes of care, so it's mostly driven by pre-stroke factors. Yep.
You know, this is a very important issue. We've been attuned to the fact that women do worse after stroke for quite a while, and we haven't really been able to tease out whether this is due to biological factors or to biases in the way that care is administered or systems are organized. And to some degree, this work helps to reassure us that we're maybe not as biased as we were concerned that we were. Would that be a fair answer?
Yep, exactly. And in another research that I'm working on, we use the data from 13 population-based studies, and we have found similar findings where women were about 35% more likely to die up to 1 year after stroke. And the sex difference was mainly explained by women's greater age, more severe stroke, poorer pre-stroke function, and the presence of AFib compared to men. So I think it's really important for us to have better management of stroke risk factors, especially for the elderly and those with more severe stroke. And also we need to understand why women doing worse. For example, that women usually have poorer function before stroke. So we need to have better strategies to improve the general health for the elderly. Yeah, general.
That's a very important point. Certainly the issue about treatment of atrial fibrillation, right? One of the most treatable causes of stroke. It's disappointing to hear that women are still getting treated less in 2018, in the era when we have low risk, easy to use prophylactic medications like the direct oral anticoagulants.
Yeah, actually in the literature there's some evidence that women receive less aspirin or anticoagulants compared to men. So we hope that in the future there will be more research to understand why women receive less aspirin. It's maybe due to women have more complication or any other causes.
Or perhaps returning to the issue of bias, that's one of them. That's something that we're still not doing quite as well.
Yeah.
Lots to take from this, and much more work to come, I'm sure. Thank you very much.
Thank you very much.